February is such an important month to take task and look at your health, especially when it comes to your heart. As we all know, it is Heart Health Awareness Month, and I am so excited to introduce you to Frankie Maldonado, who is with us to talk about LifeGuard imaging, something that I was able to just experience firsthand. But what you do here and the technology you're able to bring the Bay Area really has a lot of people talking. So first, I want to hear in your words, explain what this is all about and how you are helping save lives each and every day.
Well, we're blessed to do that first and foremost, but we have a program and a technology that we utilize to scan our patients preemptive to symptomatic conditions for early detection of heart disease and literally hundreds of potential cancers that could be silently growing within the body. The patients that come in to see us will have a scan, and what we're looking for is obviously heart disease or shadows, lesions, nodules, cysts, anything that could be peculiar, and then our board-certified doctors of radiology will monitor those changes from year to year to see if it develops into something that could potentially be deadly or dangerous.
And again, hence the life-saving option that you are offering your clients out there. Let's rewind though, and getting to know you a little bit, and of course seeing the picture on the wall, I can tell you are so passionate about this. And one of the big reasons that you are passionate about this is because of your dad. That, I think, launches sometimes our direction in life. And you can tell you take a lot of pride in that, but again, the passion. If you don't mind, speak back to why you decided to get started in this program of helping people.
Well, my father unfortunately lost his life 23 years ago to pancreatic cancer. The sad side of that story is, in January of 1998, my father had returned from a vacation with my mother, and as he described it, it wasn't something that was painful, but being a medical scientific mind, he knew that something was off in a portion of his abdomen consistent with where the pancreas is. Most people who aren't medically inclined would have probably thought it was an indigestion, a cramp of some kind. But being a scientific mind, my dad's like, I'm going to get this checked out, knowing how deadly the diseases of the pancreas are. He went to his hospital where he was chief of staff, told them to take some images, which they did with a CT scanner, not too different from ours. But traditional CT scanners are doing thicker slices than what we produce. And in those thick slices, tragically, gaps can be created where things aren't visible. My father came out of the scan, they said, "You're good, Dr. Maldonado." My dad was praising God, thought he dodged a bullet. Well, unfortunately, one of those gaps I'm speaking of was on the tail of his pancreas where the head of the cancer was, and they never saw it. 10 months later, on November 3rd, he was officially diagnosed with pancreatic cancer, and he was gone 6 weeks and a couple of days after. A horrible experience.
I am so sorry for your loss and your family's loss, and just to be able to take that story, I think that gives us insight on why you want to help people and use this technology. And I already touched on it. I've actually experienced the imaging myself. I just got out of there. And an easy process, to be quite honest with you. Very easy, very simple, and in fact, even different than what I expected. Sometimes people have horror stories perhaps when they think of MRIs or the time consuming. Not at all. Why is it important to make sure that the patient experience, the comfort level is there when people do step foot into the imaging center?
Every one of us has had an experience in a medical facility, a doctor's office, a hospital, and there's anxiety. When we talk about our health in general, there can be anxieties. Am I okay? Am I not okay? But when we're talking about deadly diseases of the heart or cancers of the internal organs, it can be terrifying. So everything that we've tried to create here, as best of our ability to do so, is to make sure that the patient's experiences are relaxed, that they're comforting, and most importantly, and you've experienced it with Brandy, she's remarkable at what she does, is that our patients are going into a machine that is not like an MRI where you're in a tube. It's a donut your body passes through that's open on both ends. The process, as you just experienced, is one. It's simple. You hold your breath a couple times for about 10-15 seconds. The machine does everything for you, so the experience is of utmost importance.
Really, and I got to tell you, it was absolutely nothing at all. And as we get ready to wrap up this first part of this conversation here today, you mentioned that we create a baseline, that this is something that people can come in, they can see how things are, and then you're able to grow on that, which most importantly, if anything were to come up, that's where they get the diagnosis that maybe they need an early detection. So key in both of these things that we're talking about.
Absolutely, and that's why, as you said, the first scan, as you just got, is a baseline scan. We will now scan you on an annual basis, and our doctors will more or less monitor what, if anything, is changing, and it's about early detection. I wish I could say that we can cure disease and prevent disease. We can't.
Right.
What we're doing with incredible success is finding these things early, and again, our patients now have information to share with their personal medical doctors and take the steps necessary to correct it.
Well, since I, of course, just went through the CT scan myself, I do have some results coming my way. So we are going to get those results in just a second. But before we do, I know you've got a special offer that I want to make sure and throw that out there for everybody.
Absolutely. So anyone who calls our phone number, which is 813-524-1010, and mentions you and mentions the Morning Blend, we're going to give them a complimentary heart scan. It's a great way to get an insight into what could be going on in the arteries of their heart that very day. All we ask is that they mention you, and it's consider it done. We got it handled.
Well, again, we're going to see what those results are from my heart scan. So stay right there. We will be right back.